Hi, my name is Dr. Castiglione. I'm a urologist and andrologist. I have a PhD on Peyronie disease and stem cells. And today I will explain you my personal protocol for managing Peyronie disease without surgery. In order to understand my protocol, it's very important to understand Peyronie disease. And what it is, Peyronie disease? Well, Peyronie disease is a wound healing disorder. It's an immune system disorder. Peyronie disease is a benign condition resulting from a fibrosis scar tissue that develops on the tunica albuginea of the penis, one of the layers of the penis. Peyronie disease causes curved and sometimes painful erection. Imagine you have a scar on your hand. Obviously, you cannot bend your hand correctly because the scar prevents the hand from stretching. The same is true for the penis affected by Peyronie disease. Fibrosis is a wound healing disorder that often occurs in response to a chronic tissue injury, and that is defined by a persisting inflammatory reaction and subsequent excessive accumulation of extracellular connective tissue proteins, such as collagens, elastin, or fibronectin. Penile fibrosis is an umbrella term for fibrotic disorders affecting different components of the penis. It can be localized either in the tunica albuginea, corpora cavernosa, or in urethral corpus spongiosum. Corpora cavernosa fibrosis is characterized by generalized fibrosis in the rectal tissue of the penis. This causes ED. If the fibrosis is at the level of the tunica albuginea, we have Peyronie disease. If the fibrosis is in the urethra, we have a urethral stricture. So Peyronie disease has two main components. One is a penile curvature and the other one is erectile dysfunction. European Association of Urology guidelines panel does not support anymore the use of oral treatment for Peyronie disease, including pentophilin, vitamin E, protaba, and so on, because there is not enough scientific evidence supporting this kind of medication. But what the panel does support is the use of PD-5 inhibitor like Viagra, Shockwave therapies, and penile traction device. Why? Because there is enough scientific evidence that prove that these kind of therapies have an effect on the treatment of Peyronie disease. So my protocol tries to treat Peyronie disease with a multiple approach. First of all, reduce fibrosis via nitroxide pathway activation. Second one, make the fibrotic scar plaque softer with Shockwave. Third one, modeling the scar with a penile vacuum pump. Nitroxide is a molecule that's produced naturally by your body. It is important for many aspects of your health. Its most important function is vasodilation, but it has also different kind of properties that make it appeal for a therapeutic purpose. One is reduction of collagen synthesis and then of fibrosis, reducing apoptosis, improving angiogenesis, antithrombotic effects. But most important, it has antifibrotic effects. Nitroxide is a neurotransmitter. It's a small, labile, lipid-permeable free radical molecule. Nitroxide synthesized from the amino acid L-arginine by nitroxide synthetases. L-arginine is a basic, genetically coded amino acid that is essential amino acid for human development. It is a precursor of nitroxide and is synthesized by the body from L-citrulline. Nitroxide activates relaxation of the corpora cavernosa smooth muscle tissue, resulting in an increased blood flow into the penis, resulting in erection. More important, phosphodiesterase type 5 inhibitors enhance nitroxide-mediated vasodilation in the corpora cavernosum by inhibiting cycloguanosine monophosphate breakdown. So, how do I increase the effect of nitroxide in my protocol? Well, by increasing the production of nitroxide and expanding its effects, using PD5 inhibitors and supplements like L-citrulline. Now we can talk about shockwave therapies. And we already explained that it makes the fibrotic scar plaque softer. How? Because shockwave breaks the scar tissue, making it softer. Important in improve the vascularization of the tissue and reduce the fibrosis itself. So we have two mechanisms already in my protocol. The first one is reduction of fibrosis via nitroxide mechanism, and the other one is a plaque softener with a shockwave. Now we have to talk about modeling the scar, and we use a penile vacuum pump for doing that. But we use a special one. What is a penile vacuum pump? The vacuum pump draws blood into the shaft of the penis and causes it to swell and become erect. The most important thing is that the penis cannot be completely bent inside the plastic tube when it's erect. The pump I use has several cylinders of different sizes and diameters, as you can see in these pictures. The narrow diameters of the cylinders ensure that the penis does not bend during the erection induced by the pump, and as a consequence, the fibrotic plaque will be stretched and reshaped. I hope that you liked the video. Don't hesitate to contact me for more information or for booking a new appointment. Stay safe and to the next video.